You know, we've been hearing for months from hospitals, doctors, even patients. Idaho's abortion ban and the associated laws have had a strong negative impact on our healthcare system. OBGYNs and maternal medicine experts have been leaving the state, with none coming in to take their place. Since the laws are too vague and restrictive, and many are just choosing to not deal with it. We've been hearing about it and sharing it with you. And today, Idaho lawmakers were supposed to hear it directly. How the laws they passed have left Idaho in the lurch when it comes to maternal and fetal care. Doctors were supposed to present their case, illustrate the impact to both the Senate and House Health and Welfare committees. Supposed to, but that meeting was canceled. Why? Here's Joe Paris.
Early Monday morning, a press release lands in inboxes. An event set for the State House. Doctors and experts telling lawmakers about the impacts of Idaho's abortion laws. Impacts on the workforce, impacts on staffing, impacts across the board. Hours later, though, an update. The event is canceled.
I think by any objective standards, Idaho's abortion law has been a disaster.
House Minority Leader, Democrat Representative Alana Rubel, was looking forward to the event. A chance, she says, to connect lawmakers with the reality of Idaho.
We have hemorrhaged doctors out of the state. We've lost 55% of our high-risk maternity specialists. We've lost about a quarter of our OBGYNs. We've had 3 labor and delivery services shut down entirely.
Monday afternoon, word started around the State House. The event with medical stakeholders is called off. Official reason in the press release: legislative leadership needed to focus on concluding the session.
I think the order came from Republican leadership. I wasn't in the room when they did it. They're trying to blame the Democrats for this. They're trying to say it's because we raised the flag and said, hey, we need to fix Idaho's abortion laws.
Republican Representative Megan Blanksma has a different perspective from across the aisle.
I think it was called off because the chairman and some of the members of the committee were really frustrated at the press conference on Friday.
That press conference was held back on Friday by the House and Senate Dems. The topic: Idaho's abortion laws.
Didn't give out a completely accurate explanation of the situation. So the Democrats came out and they had a press conference and basically called Republicans names, and I think that's when the chairman got frustrated, and reasonably so, because a lot of the things that were asserted in the press conference simply weren't true.
Blanksma understands how delicate the conversations on the topic are, but she believes across the aisle the temperature is being cranked up unnecessarily.
I think part of the reason that we're having such difficulty is the fear-mongering that's coming out of the left in scaring people, and we need to do our best to let folks know that no, Idaho believes in healthy families, and we're doing our best to support that.
We want to make sure that legislators hear the voices of physicians and frontline healthcare providers as far as what's going on and how this is impacting their day-to-day care.
Dr. Lauren Colson was supposed to speak to lawmakers at the event. Here's what he wanted to convey.
Just here's what it's like. Here are the struggles that we're having right now. And so that our legislators can know on a first-hand basis what it's like for us as physicians right now.
He believes some lawmakers will remain in the dark, not knowing what they don't know as a result of the canceled event.
Lawmakers who, in their own right, aren't medical experts, are sometimes having a difficult time understanding why we can't just stop doing abortions and continue providing OB care and reproductive care as we were before, just without abortion, and just to explain those situations and those complications that arise that maybe they didn't think of before when this law was passed.
For lawmakers, time is running out for the 2024 session. Still, Democrats and Republicans know there's a major conversation that needs to continue.
I think they were really afraid of the information that was going to come out of this hearing. And I think they were afraid of having more of a spotlight shone on essentially the disaster they have created with this abortion law.
They were trying to have a conversation, try to come together, get us all on the same page, and then they felt like essentially a bomb went off, and then it gets difficult to have the discussion. So now you're going to have a committee hearing after a press conference that isn't about having the discussion, and that's what it was supposed to be all along.
Another factor in all of this is IVF, in vitro fertilization. You may have seen the news. In the state of Kentucky, their abortion laws inadvertently or intentionally, depending on who you ask, it actually criminalized IVF, or in vitro fertilization. So here in the Gem State, there's been a lot of talk about it. And part of the problem between the Republicans and the Democrats is on the House floor last week, there was a speech made by Representative Brooke Green, a Democrat, and she basically said that I have a piece of legislation that's going to get read across the desk, but we need to have IVF in state code. And And Brian, kind of the hiccup in this whole thing is that there was a petition that was circulated, and I know you can't see it, but take my word, there's a petition that was circulated across the State House that essentially says, okay, we understand that IVF is important. We want to make sure that Idaho families can use IVF, and there is, the way that they say it is that after a diligent legal inquiry, they've concluded that there's no statutory obstacle to the continued offering of this important option. Basically saying we don't need to make a law about IVF because it's legal. Our abortion laws don't mess with that. Some people, some Republicans, were upset that Representative Green got on the floor and the word impugn comes up, kind of talking about what Republicans could believe on IVF. So the whole thing kind of is very messy and a very complicated situation.
So we don't need a law about something that isn't happening in Idaho. Got that. Write that down. Okay. I guess my question for Representative Blanksma, though, is it fear-mongering from the left if it's coming directly from the doctors?
And that's a good question, but Representative Blanksma also wanted to add into the conversation that there are things, especially that she's carried, that take care of pregnant women and make sure that pregnant women in Idaho are taken care of. It didn't make the story, but a soundbite that I have with Representative Blanksma that says if we're going to live in the condition that we've created with the abortion laws, we need to take care of women. So I think there was some in the Republican camps that say, I don't know if there was attention given to what we are doing. So depends on who you ask.
Okay. All right. Thanks, Joe.